Hello and welcome to today's episode of the Health Collective podcast. Now, today I'm talking with Efrat Lamandre, Dr. E, who is the founder of the New Method, where she, from a traditional medical background, now works with patients to finally realize that their symptoms are not just in their head. She helps people essentially prevent illness, reduce medication, and feel better by getting to the root cause of their illness. And she talks about this in more detail in her book called It's Not in Your Head. Your body doesn't feel right, but you don't know why. In today's episode, we really look at the foundations of what functional medicine truly is and how to understand if you are chronically inflamed and certain lifestyle methods that you can change to get on top of this inflammation before digging deeper. We really look at why traditional medicine, although super helpful when we are ill already, is not so helpful if we're pre-diabetic or pre-hypertensive. What we look at is how functional medicine can prevent becoming ill, because it is only at the point of being ill that you can really get put in the medical system. So if you have been feeling tired, brain fog, stiff, or any other chronic symptom that's been going on for a long time, then this is the episode for you. Now, if you need any more help in your body, inflammation, weight loss, toning, or acceptance, then feel free to get in touch with us. Head to the website www.thehealthandfitnesscoach.com. Enjoy the episode. So today, as I mentioned, we are welcomed by Efrat Lamandre, who I'm going to refer to as Dr. E moving forward, because why wouldn't you when someone's got such a cool pseudonym to work under? So first of all, welcome to everybody listening and welcome to yourself, Dr. E. Thank you so much for joining us today.
Thank you for having me.
Oh, it's our pleasure. Thank you for taking the time out of your day. And before we really start to delve into some of the areas of expertise and topics that we want to sort of focus on today, could you give us maybe a little bit of your background? A lot of people may already be aware of you, but it would be great to understand a little bit about you, your background, and what led you to founding the New Method, what led you to really writing your books and the thoughts and ideas of what you espouse today.
Thank you. I'd love to do that. And I promise not to make it boring because no one wants a boring intro. So I started off with a primary care practice. So just think of your GP. And I was seeing patients just like, I was taught to see patients. And I would have many patients come in and say, hey, I don't feel good. And I would do exactly what I'm supposed to do. I would run the labs and they would come out perfect. And I would say, but you're fine. And I would say that for years. And I never realized that how disempowering it was because I really thought everything was fine. And then, I had no further tools to help people. And eventually what happened, and this happens to most of us who are in this vortex, is either you yourself get sick or someone that you love gets sick. And in my case, my wife got sick. And we went on a journey. And I'm in medicine, she's in medicine, our friends are in medicine, and we had no answers in medicine. So we started looking elsewhere. And that is how we got to, I call it the vortex because once it's like a rabbit hole, right? Once you go in, you're all the way in. And we found our solutions to her autoimmunity through functional medicine. And then I realized there was so much more that I didn't know. And I started going back to school, taking one class after the other, eventually getting my PhD in integrative medicine. And then I brought it back to my patients and developed the New Method. So the New Method, it's called the New Method. New is spelled with a K, because the patients always know. You always know there's a better way. Either there's another answer. You just have this feeling, something's up. So it's the new. And the reason I call it a method, because I'm still coming from a place of evidence-based practice and conventional medicine. And I like things to be as objectively measured as possible so I could gauge improvement, and et cetera. So that's where the name came from. It came from the patients knowing, but then eventually me catching up and realizing, yes, there is a better way.
Absolutely. And I love the fact that you were, from a medical perspective, and I use this word not lightly, but you were humble enough to be aware that there was more that you could bring to the table. And probably one of the things that a lot of people, obviously, you're in the States, I'm in the UK, but there is a similarity in Western medicine that says the doctor's always right and you must listen to the doctor. And there is a hierarchical sense that when you walk into a medical practice, you as the patient are at a lesser intellectual awareness of what's happening. So often people can maybe feel scared or nervous or unsure about voicing their own thoughts when the doctor says, well, this is what the facts say. So, do you find that now that you started to look at more of a functional perspective, that people come to you with a different sense? Do people open up to you more? Are they more honest with you? What's the relationship between you and the patients like now that you've started to explore different areas?
So yeah, I'll tell you about the relationship with my patients, but I'll also give your listeners kind of a tip of how to manage this feeling of, you're right, there is kind of a knowledge hierarchy, not just with doctors, right? If you go to a lawyer's office, if you go to a pharmacy, anywhere you go, some people went to school, and the people listening, I'm sure if I went into your industry, maybe you deal with mortgages, maybe you deal, I'm sure your area of expertise, you can only know so much. So I first want to empower patients. Don't get mad at the system and don't get mad at your providers. No one went to school with a desire to hurt or to be malicious, right? So they only know what they know. So I always tell my patients, if you don't feel well, you must start with your GP, right? You must start with your PCP here in the States because you have to rule out the biggies, right? Don't run to the functional medicine diagnosis like adrenal fatigue and maybe it's mold. Make sure you're not anemic. Make sure your thyroid's on point. Make sure you don't have a pathology going on. So your relationship with your PCP is his or her job is to make sure you're not sick. So if you're not sick, you're walking out and it says everything is good, that's great. That's great news, right? So don't be upset. Don't be mad at them. Don't say, I can't believe you don't know. And I saw this thing online. Use their tools. And then you have to go and find someone like me or like you who is going to use a different set of tools. But I am sure that when you take on a client like myself, I won't take on a client that hasn't already been through several medical providers. I need to know that they left no stone unturned. I need to make sure that they did their screenings and everything is done. So do all of that, and be empowered that there's nothing wrong. And then what you're in the world of something's cooking. And when you're in the world of something's cooking, you may not be able to see it on the lab, but now you need someone like myself or like you who's going to go digging deeper. And so when I sit with my patients at the new method, it's an hour-long consult. And this is how the rhythm always goes. They come in and they talk really, 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 really fast because they're so used to have like 5 minutes to like tell their story. So they tell a story really fast. And I was like, okay, you got that out. Now we're going to start from the beginning. We are not in a rush. And we go back from the day they were born. And because it's your entire life, just like it's in your entire body, right? It is your entire life. It's your entire body. It's not just what happened since menopause. It's not just what happened since COVID. It's not ever since the divorce. It actually started before that. So, where my relationship with my patients is such that I create an environment to allow that. But your GP can't do that. The constraints of conventional medicine don't allow it. And it also doesn't change the tools that they have. So just like you call a plumber for plumbing, an electrician for electric, go to your GP for the sickness and then look elsewhere for the wellness and to discover the underlying issues that you feel in your gut are happening.
I love that. And it's about understanding where to go for the response that's appropriate at that point. And before we dig a little bit deeper into that functional medicine, because I think it's something that we probably need to explain as to what that actually means. You mentioned, don't get mad if you've, for instance, as an example, seen something online or you have a thought. Now, do you mind if I ask how long have you overall been in medicine?
Overall,
Yeah.
so I've opened my original practice 10 years ago. And
Okay.
then The new method was in the past 5 years.
Okay, so in the last 10 years, we've seen huge advances in people's ability to use technology. And I mean this from a very lay perspective, that especially with the pandemic, we all got forced into this environment, right? We don't
Yeah.
go to each other's studios anymore, we just meet up online. Have you found a difference in people's attitudes or perspectives of their body and medicine since Google became the second doctor?
Yes. And, I'm sure many of my colleagues would say that it's not a good thing that people have this, because there is this like understanding it halfway. But I think the key is not whether or not patients have this information. I think it's wonderful that they have information, because it brings things to the table that maybe we would not have considered. I think the key is in how it's presented, in the attitude it's presented, right? So, and this is true not just in medicine. Like you're just not going to walk into someone's place of business and just say you're doing everything wrong, right? It's just not. You don't want someone coming to your place of business, wherever that is, or your home, and saying, "Hey, everything you're doing is ridiculous. You're doing it under a conspiracy," right? So it's really in the presentation, right? I love that patients are empowered, because they might say, "Hey, what do you think about this?" And I'll say, "Huh, that's a possibility. Let's explore that." Or maybe I need to tell you why it's not that, because that will also give you some satisfaction. If I could say to you, "Listen, it could be that, but if you need to see this, 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 and this, and that's not what's happening," right? So
Mm.
let me give you an example of both sides. I have a lot of patients who say, "I really, really think I have a thyroid issue. And I went to my GP and I don't have a thyroid issue." And then I'll say, "Well, let's dig a little deeper," right? So on the one hand, it's let's dig deeper. And then we do different testing. And in fact, they have a thyroid issue cooking, right? So that's an example of the patient who's like, "My mom has thyroid. I feel like I have all the symptoms. I've read it all online. And then you come to me and I see all the things." And I'm like, "You're right. Your GP just doesn't test for certain things. You're right." Same scenario. Patient says, "Listen, I have all the symptoms. I really think I'm fine. I read all this." And I'm like, "Listen, I've I've tested every possible test. I went way, way, way deeper than the GP. I'm letting you know. I just had this conversation. I'm letting you know it's 100% not your thyroid. And I encourage you to now let's look at other possibilities instead of being tied into this." And
Mm.
sometimes that takes work as well. But I'm able to say, like, let me show you what's different, and how my testing is, that I can 100% tell you it's not your thyroid. So same information, right? It just sometimes it could lead you in one path, but sometimes it could really block you. I'll have patients who can come say, and they've connected things. This happened, and then this happened, and this happened, and I'm sure it is because of that. And I'm like, "Well, let's take a step back and maybe we look at things differently." So sometimes it locks you into a diagnosis. The client, the patient, is so sure that this is the thing. And sometimes that stands in their way of actually seeing the thing. So as long
Mm.
as you're coming to it open-minded, "Hey, what explore it?" And then as professionals, we need to be open-minded also and say, "Yeah, let's explore that as well." I think it actually can help us get to brand new places.
Mm. I love that. I think that's a really interesting way of looking at how the tools that are being created, and I can foresee in medicine that AI, for instance, I've already had clients ask Chat GPT, these are my symptoms, what could be wrong with me, right? So people are already trying to expand into those areas, but seeing it as a help and an empowerment rather than a hindrance or a threat, I think is a fantastic
Oh yeah.
viewpoint.
If you're going
Absolutely.
to be scared of technology, you need to close up shop.
Yeah, I completely agree.
Yeah.
So you mentioned your wife and that you're both in medicine, your friends are in medicine, and medicine said nothing was wrong. And this was a starting point for you.
Yeah.
Have I got that right?
Well, in her case, it wasn't that nothing's wrong. In her case, it was only medication can help it.
Right. Okay.
Um,
So for those people who maybe the labs are coming up saying, "Hey, you're all good. There's no medication. This is very black and white," but they know that
yes.
something's not right. And this is where functional medicine comes in. So could you give us a bit more of an expanded idea of what that truly means?
Absolutely. So the name of my book, which is behind me here, is called "It's Not in Your Head," right? Because this is the classic scenario. Classic scenarios: I don't feel good. Things are, maybe I'm not sleeping well. I'm fatigued. I'm having trouble losing weight. Brain fog. My joints hurt me. There must be something wrong with me. I just don't feel like myself, right? So we do everything right. We get our mammograms, we get our colonoscopies, we get our pap smears, we get our prostate check for men. We go to the GP. We do all these things. Everything comes back normal. Maybe a little cholesterol, something that doesn't really explain why you're not feeling so unwell. And then the provider says to you, maybe you just need to exercise more, maybe just drop a few pounds, right? As if it was so easy. And then sends you on your way. Or you might be like, I'm not accepting that. And you go for more testing, and you go to the rheumatologist. And now becomes a point where they start to insinuate that maybe it's your anxiety, or maybe it's your hormones, or maybe it's in your head, right? They don't actually say that you're crazy, but if you keep pushing and everything comes back normal, they're going to start saying, maybe we need some antidepressant, anti-anxiety medication. Right? It's an insinuation that to a certain degree, it's in your head. And so again, to their tools, everything is fine. And the issue really is, and you're right, this is where functional medicine comes in, is that the labs become abnormal once you're already sick, right? So if you have diabetes, you're going to come up positive for diabetes, right? When you have eaten your way there for many, many, many years. But on the way to diabetes, for those years prior, you're not going to feel well, right? I always use this as an example because people can relate to this. You're not going to feel well for many years, and you might go every year and get your sugar checked, and it's fine. Maybe a little pre-diabetes, but it's fine. Your sugar's fine, everything's fine. But that if today I got diagnosed, certainly for the past 10 years, I'm sure I've had certain symptoms, but the labs didn't show it. That's true for autoimmunity too. I may have these aches and pains, and I really look like maybe a rheumatoid arthritis, psoriatic arthritis, or something else. But when I go to rheumatology, those labs are normal. And that's because I haven't been sick long enough to convert those numbers, right? So it's actually called seronegative, right? Your serum is negative, but you have these symptoms. So conventional medicine cannot help you until those numbers turn positive, because they cannot give you medication, which is their only tool, until they have proof on black and white that you warrant this medication. So you're on your own, and you have to come back when things are worse. If you went to a neurologist for your brain fog or your memory issues and really having trouble remembering things, you're going to pass the neuro test, because the neuro test is for very, very people with extreme dementia. You're going to pass the neuro test, and they'll say, there's nothing we can do, come back. So you have to be ill to be in the system. So what happens to all of us who are just not well, but are not ill? This is where functional medicine really thrives, because it's this understanding, still all evidence-based, it's still using as much data and objective measures as possible, but it's understanding that the symptoms count. If I can't sleep, there's a reason. If my joints hurt, there's a reason. I don't really need to see it on paper to give me the validation that I have something, right? If I look like a rheumatological picture, if I look like my joints hurt, does it matter that it's not on paper? No, because I'm not going to try to give you medication. I'm going to say to you, okay, if you're not feeling well, at the heart of it has to be inflammation. What is the cause of your inflammation? And then we spend time digging on, is the cause of inflammation your nutrition? Is it your lack of sleep? Is it because you're exposed to something? Is it because your hormones are imbalanced? And so now we start looking at causes of inflammation, which caused your I don't feel good-itis. And the beautiful thing is, if we find it, we can prevent you from ever becoming sick, from ever getting that positive, right? So it's a way of understanding that the symptoms really, really count. Something's up and something's causing it, and then looking for those root causes.
It's really interesting how you speak about the two different types of medicine, and essentially the functional medicine is preventative, whereas traditional medicine is essentially looking at a cure once you've already gone through into that. You're now ill enough to actually warrant medication. So from the preventative side, the functional saying, okay, let's find the cause so that we can prevent it ever getting to that stage. what are most of, I guess you could call them the prescriptions, but are most of the solutions that you would provide at that stage lifestyle based? You know, for instance, whether it be pre-diabetes, bringing sugar levels down, whether it's, you know, inflammation in the gut and changing nutrition. Would you find that they're mainly lifestyle based solutions, or does medication still come into play at that preventative point?
It's a really good question, because what I was going to say is many times we need both worlds.
Okay.
So let's give some easy examples. If I come in and I already have hypertension, I already have high blood pressure, I would certainly not tell you to come off the blood pressure medication. If you're on diabetes medication, stay on it. If you're on anti-anxiety medications, stay on it. That would be crazy to tell you to come off of it. But the goal would be to see what can we do to maybe get you to a point where we can reduce medication or come off medication, and at the same time preventing from needing medication, right? So sometimes you need both. And sometimes you depends where you are in the spectrum. So you could be very early on in your spectrum where you just don't feel good, but the wheels aren't falling off yet. And sometimes you're further along in the spectrum where you haven't been feeling good for a long time. Now you're already on 2 or 3 medications. So you're going to need both. It really depends on where you are in your journey. So it's not a promise of you'll never need medications again, but it is a promise of, but let's make you the best version that you are right now. So maybe to help you either come off or not need medication. So lifestyle changes, yes, but in a really specific way. So if we're looking for, inflammatory, what is the cause of your inflammation? It's not going to be like, hey, I just need you to lose 10 pounds. It's going to be like, hey, what's happening in your nutrition that is causing your maybe leaky gut and inflammation? And when we change your nutrition so that the inflammation goes down, by the way, you'll also lose 10 pounds. But you could lose 10 pounds and not reduce your inflammation, right? Like I can eat 10 chocolate bars a day and not eat anything else. I'll probably lose some weight because I really won't eat a lot of calories, but I will do nothing for my inflammation, right? So, weight loss, while it's important in and of itself, may not reduce your inflammation. So telling someone, hey, just lose 10 pounds might not make a difference at all on how unwell they feel. Telling someone, hey, maybe we need to go gluten-free and dairy-free. Maybe we need to eliminate legumes for a while. Maybe we need to focus on what things are agitating your system. That is going to bring down inflammation. Oh, wow, your belly's a mess. Maybe we need to really personalize some supplements to make sure that your belly is healed, and bring down inflammatory markers. So it is lifestyle based, but it is really targeted on what is causing the patient inflammation.
Okay. So let's expand a little bit more on that word inflammation. So our regular listeners will have heard me talk about inflammation till I'm blue in the face from a health and lifestyle perspective. And I talk about it both from someone who has suffered from arthritis and used nutrition to heal and help a lot of the symptoms. But equally from the perspective of the body struggles to shed excess pounds if it's in a highly inflamed state. So, from your perspective as a functional medic, how would you describe inflammation, and what are the causes that can then happen from a physiological state if your body is inflamed?
Okay, excellent question. So there's 2 kinds of inflammation. One that we absolutely need, which is acute inflammation. I fall down, I hurt myself, my ankle gets swollen. That is really important. That is how we heal. The area kind of sequesters this area that got injured. It brings a whole bunch of soldiers and inflammatory markers to the area to heal it as much as possible. It gets really hot and uncomfortable for a while, and then it goes away, problem solved. Acute inflammation, very necessary. It's how we stay alive. The problem becomes when we have this constant chronic inflammation, right? I didn't hit myself. I wake up in the morning, I'm feeling really stiff. I didn't hit my knees. Why am I feeling so stiff? That is chronic inflammation. It's your body's responding to something, and it is constantly mounting an inflammatory response because it thinks you need it. It thinks you need this inflammation. Something's happening, right? There's something on board that really is requiring your immune system to be extra vigilant and create this inflammation, but you haven't figured out why it's creating this vigilance. So all you're getting, remember I told you about that ankle hurt you for a few days, but then it went away. But all you're getting is this constant pain, or this constant rash, psoriasis, right? Eczema, or this constant brain fog. That's neuroinflammation. So you have this constant state of inflammation and you don't really know why. Now, it's not a level 10 attack, right? Like I have the flu, I'm like mounting a fever. It's a consistent level 3, 4 attack that's happening all day, every day. And so my body has to respond to it all day, every day. This inflammation is going to affect your weak spots. If you're genetically designed to have a thyroid issue, it will show up in your thyroid. If you're genetically designed to have joint issues, show up in your joints. So the same inflammation, the same markers will create different diseases in different people. But at the root cause of every single disease is a state of inflammation. It's just expressed differently in different people, which is why you might say, how could it be that you're changing lifestyle works for everyone? Because it's not disease oriented, right? It's inflammation oriented. Conventional medicine is disease oriented. You need high blood pressure medication. You need diabetes medication. But we're going a level before it and saying, let's manage inflammation so it doesn't express in a disease. So that is what inflammation is. Let me pause here for a moment.
I love the very specific sort of way that you explain the two different types of inflammation, because absolutely, to a sense, pain in an acute sense is good. It's a message that says, hey, something's wrong, you got to fix that, move your hand from the fire, don't burn yourself. So sometimes pain isn't always bad, as long as we listen to the message and we do what we need to do to respond. So that chronic inflammation, how would someone know if they were chronically inflamed? Because in today's society, most people scoff things off. And what I mean by that is, oh, well, I'm tired, but that's because I worked a lot. Or I have no energy because of the kids. Or, oh, yeah, I'm a bit stiff, but I'm just getting old, right? So when we have these chronic underlying level 3, 4 issues, most of the time we just kind of put it down to that's something I've got to accept about myself. And that's mainly because I don't know if you find it in the States, but in the UK, there is a culture of just shut up and get on with it. So how would you help someone understand if they need to shut up and get on with it, or if there's truly something that is an underlying issue?
That's such a good question. So you don't need to shut up and get on with it. Just because you're not shutting up and getting on with it doesn't mean you're also all day long whining about it, right? Like, it's not one or the other, right? Like if I just don't complain about it, then I won't be perceived as weak. No, those are not your only two options. Okay. So let's say this. You're right. Culturally, I think in a lot of modern societies, it's more and more, do more and more, don't complain. The other, not only is it more and more, do more, but everyone around you is not feeling well. So instead of saying, well, maybe all of us are inflamed, maybe all of us are eating wrong, maybe all of us could feel better, we say, oh, this must be what it's like to be 40, because everyone who's 40 is not feeling it. This must be normal for 50, because my friends are all on one medication, I'm on one medication. This must be 50. So not only have we normalized not complaining about it, but we've normalized that not feeling good is age related. And when we see the outlier, that 70-year-old that's still golfing or tennis, we're like, well, I don't know, that's crazy. No, that's the norm. That's the achievable norm of what your body can do when you don't constantly introduce it to things that cause inflammation. That is all possible if you just stay the course that you were designed to. If you didn't introduce all these like chemicals and staying up at night to get your work done and the stress and all these things, right? So we've normalized not complaining. We've normalized not feeling well. We've connected it to age. And if we are brave enough to complain about it, we get shut down in the first visit. So really, how do you blame people for like coming to the conclusion that this is just normal? You have to hit a wall. And I notice this with my patients too. If my patients are coming in, my clients are coming in, and they're just kind of sort of not feeling good, they're not quite ready to do the steps they need to do to get better. But when it starts affecting their daily living, they're not able to play with their kids or their grandkids. It's affecting their relationships, affecting their job. And now they're willing to do what it takes. So it's not just it works in the sense of people are not willing to give up what they need to give up if they're also haven't been unwell long enough. Does that make sense? So
Absolutely.
how do people know if they're inflamed? If you don't feel good, you're inflamed. If you have brain fog, you're inflamed. If you're stiff, you're inflamed. If you have rashes, you're inflamed. If you're taking medications, you're of course inflamed. If you're not feeling the way you know you can feel, you're inflamed. Whether or not you want to do something about it, that's on you, but you're inflamed. You don't need a test for it.
So that doing something about it, to sort of finish up, what I want to do is look at probably the key chronic issue that our listeners have, which is lack of energy. So let's take a classic. If I looked at a classic example of one of our listeners, maybe this might be you listening out there. You're maybe 48, 49, and you've got 3 kids who are sort of 16, 14, and 12, and they're constantly needing taxiing around to the various different extracurriculars that they do. And you've got a husband who you love dearly, but he doesn't really do a lot around the house. You're working 45, 50 hours a week. You've got a mom in a care home who you're also trying to look after. You've got friends who have got all of their problems that you're constantly listening to. And the only time you feel that you can relax is maybe 10 p.m. at night when you finally sit down to just binge on Netflix, and suddenly it's midnight and then you're waking up at 7. So you think, well, I've had 7 hours sleep, but you feel horrendous. I was going to use a different 4-letter word there, but you feel awful and you just can't get out of bed. And this low energy has now been going on for 2-3 years. As this classic example, is this something where the obvious answer is, hey, do less stuff, go to bed earlier, feel better? Or if this really low energy has been going on for a few years, is there a secondary inflammatory issue that this woman might need to look at beyond what I guess we could all perceive as the obvious?
Okay, so there's a few levels to that. And I'm not going to be the person to tell you to do less stuff because it's not realistic. Your mom's in the home, your kids need you, your job needs your job, you need to put in the tail. So telling people to do less, that's not really the answer. Because then you'd be like, okay, thank you for this podcast. Goodbye. Right. So there's a few parts here. What you didn't talk about is what this woman ate all day. Okay, so as she's rushing, is she going through the drive-through, eating the kids' chicken nuggets because she didn't have a moment for it? Having some sort of pizza or pasta or something like that, like a quick lunch. And then when she feels down, she's grabbing a Starbucks and like another, I don't know if that's popular where you are, Starbucks, but she's grabbing a cup of coffee and a cookie at 4 p.m. Like what is happening for her nutritionally? How is she filling up her gas tank? That's really important because if you expect to do all these things, and I am not one to say to do less. If you saw my schedule, you would pass out. I'm a fan of doing more. But how are you fueling your race car? That's number one. How are you fueling it? So what are the choices that you're making nutritionally? And I don't mean I do not cook. So I could do this on the run. You can have grilled chicken everywhere these days, even Wendy's, I don't know if there's Wendy's in the UK, but like even fast food places have, it doesn't mean that you have to cook things. It's nice if you can. It doesn't mean you have to meal prep. It's nice if you can, but you don't have to. That's not where I'm going at with. I'm going with. Second thing is so putting in the gas. Next, you're saying, is there another source of inflammation? Maybe there's another source of inflammation, but let's just say that there is. How we treat that source, and let's just say she's also has adrenal fatigue. Let's just say she also has some mold toxicity. Let's just say she also has, some sort of parasitic infection. At the end of the day, we're still going to come back to, but how are you managing your body? If you say to me, hey, I have mold and, I've been exposed to mold, I'm still going to have to fix you nutritionally and your sleep and your stress before I can even detox you from mold. So you can't skip these parts. You can't say, you know what, I don't think it's that. It can't be as easy as I'm not sleeping and I'm not eating. It must be something more. Because even if there is something more, no one can actually take care of that until you get this right. And by getting this right, you're going to cut down at least 50% of the symptoms, even of that other thing. Right. So people sometimes get so caught up in the chase of finding out what it is. But at the end of the day, if you're working with a provider that knows what they're doing, we're going to start here anyway. What are you putting in the gas? Are you going to the bathroom? If you are not pooping at least once a day and you're just filled with like all your toxic waste, where are we going? Right. Is your 7 hours of sleep quality sleep? Or, is your cat running around and your dog running around and your husband is snoring and like you're really not getting 7 hours, the TV is on? Like, what is happening during those 7 hours? Are you really worried about your teenagers coming in at 2 o'clock in the morning? Like, what's happening in those 7 hours? Are you moving? I'm not saying exercise because that's not possible for everyone, but it is possible to put on your shoes and take a walk outside for 10 minutes. I'm not saying a half hour. I'm not saying an hour. If you could do more, God bless. But everyone should be able to have 10 minutes. If you don't have 10 minutes, tell me you don't have 10 minutes, park your car a little farther. Like there's ways to get movement in your day. So do we have the basics on board? And yes, life is stressful, but are you spending any time de-stressing? Are you taking 2 minutes to sit in your car and take deep breaths? Didn't say join a meditation class. Didn't say go to yoga, right? Nothing unrealistic. Like it's about finding things that are realistic. Are you taking the 2 minutes in your car before you pick up your kids to just inhale and exhale? Because that takes like 60 seconds, right? And they said 2 minutes, so 120 seconds. So are you doing the basic so that you can be the best of the best in all these places you want to be? Right now, if you have luxury of getting some of these things off your plate, great. But I want to make you the best of the best in your reality, using the things that you have going on in your life, so that you can continue being this way. And so we have to start with the basics. After you have the basics word, and like sometimes I'll have patients who will come in. Listen, I do the thing. I sleep. I'm gluten-free, dairy-free. I eat this, I eat that. I'm taking these supplements. Look, I'm on point. I still don't feel well. That's when we start hunting to go forward. Because now I can actually work on helping you. Now your body can handle the detoxification or the different supplements, etc. So this is where we have to start for everyone. I know it's the boring answer, but it really is the only way to do it.
For me, it's just a relief. For one episode, I'm not the one saying it. It's great that I'm not the one saying, unfortunately, we have to understand in this Amazon Prime society where we expect to spend a few bucks, get a pill delivered the next day, and fix all of our problems within a few seconds, that actually the consistency of habit and looking after that engine, that body, is so key before we can really start to delve any deeper, because we are all looking for that silver bullet, but the silver bullet won't work if it has nowhere to actually sort of house itself. So I appreciate you taking that consistent off me for one episode. So that just leaves me to say thank you so much for your time today. It's been absolutely fascinating talking with you. And as always, for those listening, if you'd like to get in touch with Dr. E, all of her details will be in the podcast episode details. So feel free to go and check her out and everything that she does. But absolute massive thank you from me to everyone for listening. I hope you've found today's episode as enjoyable as I have. And thank you so much, Dr. E, for giving up your time to be with us today.
It was an honor and a pleasure. Thank you.
Thank you so much. All right, I'll see you all on the next episode.